Good afternoon, everyone. Welcome to the session, Utilizing CHWs, Promotoras, and Health Access Enrollers to Reduce Fears in Immigrant Communities. I'm Sarah Diaz from the California WIC Association, and I will be your moderator today, assisting with the Q&A and chat throughout the session. Joining me today is Georgina Maldonado from Community Health Initiative of Orange County. Before we get started, I'm going to take a few minutes to go over housekeeping items and announcements. This webinar is being recorded and will be available on the Hubelo platform and can be viewed by registered conference attendees through October 28th. We will be taking questions for the speakers at the end of the session. Feel free to put them in the Q&A box throughout the session. Please submit your questions via the Q&A function, which is located in the top right area of your screen. We'll do our best to address as many questions as time allows. We are providing continuing ed units for registered nurses, IBCLCs, and registered dietitians through the California WIC Association. So please complete the conference evaluation to receive your credits for attendance. And lastly, Zoom has been having some technical difficulties and outages this morning. So if you have friends who aren't able to see the session today, let them know that if they keep trying and refresh or copy paste the URL into a new tab, it should come up for them. And with that, I will turn it over to Georgina.
Thank you, Sarah, and good afternoon, everyone, and happy Monday. It is an honor and pleasure to be here with you today. When I was asked to conduct this presentation, I was excited about it because it truly exemplifies not only our history and our credibility in the community in Orange County, but the model that we have followed since the inception and founding of the organization. Now, we do have partner CHWs all across the state, and if any of you are here, thank you for being here. And one other element that I wanted to mention to all of you is historically, we have always focused a lot on the promotora model, the community health worker model, and there's been periods of time where we notice that, you know, there's an ebb and flow, right? During the era of the healthy families, there was a lot of enrollers out in the community, and then as more people got enrolled, then it would taper off. And so it all depended on what was happening in the healthcare industry and just overall what the needs of the community are. But one of the things that has been consistent for most organizations who are community-based is the promotoras, the health access enrollers, to truly be on the ground and help reduce fears for our immigrant communities, because that is why we all are trusted individuals and the point of entry into resources for our community. Go ahead, Jody. So I more or less described what the community health worker model is in my introduction. And so what's happened is we know that this model works. I'd like to cite the Community Health Council's May 2017 report. It's called The Role of Community Health Workers in Health Systems. It's a multi-sectoral exploration. The role of CHW has garnered visibility and is highly regarded as an effective evidence-based model. So if you notice, 2017 was just maybe 3 years ago. However, this has gone on for many, many years prior to that. That study that was conducted was truly to vet the importance of a community health worker in California and overall in the nation. And its value is clear during this pandemic because, at least in Orange County, we're having a lot of promotoras go out into the communities and ID the underserved communities who have been most negatively impacted by COVID. And so what's happened is it's honed in on the continuous importance of the community healthcare model. Go ahead, Jody, next one. So I wanted to give you share with you the current landscape of the policy and also what's happening during this pandemic. If you notice in bullet point 1, back in August of last year, we experienced the negative impacts of public charge, because what happened is we were receiving a lot of phone calls, our clients saying, you know, do I apply? Do I not apply for Medi-Cal? Is it going to negatively impact my residency status or in the journey of obtaining residency in this country? And so what we did was we tried to stay up as much as up to date as possible during those, you know, the confusion of the public charge, where in August, yes, it was going to happen. Then in October, it was halted. And so that creates a lot of confusion with our communities. And I'm sure the communities that you all serve as you are part of this conference. And so in bullet point number 2, what's happening now with the pandemic is that we are looking at a significant amount of unemployment, which if the individuals that we serve have employment and had health insurance coverage, now they're looking at no longer having insurance coverage, thus going into public assistance for healthcare coverage. And who do they always relate to? Us, the community health workers who obtain the information, and we are a trusted entity in this community. And so just to give you a snapshot of, you know, any of you that are from Orange County or just statewide, but I'll share with you some numbers from Orange County, and the projections are staggering and heartbreaking. And I was part of a presentation where Professor Mira Farka from Cal State Fullerton shared that in Orange County solely, we were going to lose about 340,000 jobs just in the county during the course of the pandemic. Now, when we translate into what is happening statewide, I'm sure most of you know that the statewide unemployment rate is pretty staggering. Now, one of the elements that comes into play with unemployment is not having health insurance coverage. And with that, we're estimating that 1.6 million to 2 million individuals will be eligible for Medi-Cal during the pandemic. And so this is statewide. Now for Orange County, again, for those of you who are from Orange County, we're looking at about 134,000 individuals who will be eligible for Medi-Cal during the course of the pandemic. And so as we look at the different models in the community and you draw back the importance of the community healthcare worker from the previous slide, we do have to recognize that we continue to be the conduit to access to healthcare. But now, and I'm getting a little bit ahead of myself, but I'll just give you a primer, is that not only does our team provide the health insurance coverage, but we're also seeing referrals for food security. We're also seeing referrals for housing. So there is this intersectionality between health and housing. We're also seeing an intersectionality between health and food security, and nevertheless between health and immigration status. And so as many of you are aware, most individuals who reside in California are eligible for health insurance coverage. Now, the only population that is left for us to enroll are the individuals between the ages of 26 and 64. And so that is coming up in the pipeline. I know that the state is working heavily on that. Our partners in Sacramento are working heavily on that. But as of now, most individuals who are documented or undocumented and who are part of our community are able to receive healthcare coverage. And so that's what we're looking at the moment. Next slide, Jody. And so there's a poll coming up in a few minutes. So going back to what I mentioned, the sources of information have been and continue to be pivotal in how we, not only do we obtain the information, but how do we best educate and disseminate the information, where today they're telling us one thing and tomorrow is something completely different. And I want to go back to August because it was truly impactful for our clients and maybe for your clients as well, and you can all relate, is we would receive lots of phone calls because some of our clients rely on the Telemundos of the world, on the Univisions of the world, or any type of independently owned media outlet for information. So we're looking at public agencies as sources of information. We're looking, obviously, number one is always the media. The current health plans that we probably have access to because of our healthcare coverage, we also look to them for information. Now, one of the partners that we have had, and this goes back to our partnerships in the community. So I wanted to highlight the trusted community institutions that is part of the slide. What's been happening is our clients call us and say, well, I need a COVID test, but I call one hotline and they charge me $20. I call a different information line and they're charging me $250. So then that leaves us as community health workers, promotoras, or health access enrollers in some type of a bind, because sometimes we don't really know what the real price is. We're hoping that because most individuals have health insurance coverage, that they would be taken care of by health plans. But unfortunately, there continues to be a lot of misinformation. So we are relied upon to figure out and disseminate and try and figure out what is the best information out there so we can continue to be a trusted source of information for the clients that we serve. And so, I wanted to conclude this by saying that, CHWs, promotoras, and health access enrollers are obviously critical as this pandemic continues. And it's important for us to continue to connect. It is important for us to continue to try and be on the same page with each other as a trusted community institution, because we are also experiencing that confusion, that frustration, and ultimately for our clients means poor health outcomes. So that's where I will leave you with this slide. So right now I'm going to do a poll. If we can get that. Okay.
So the poll was sent over, and Sarah will be sharing the results of that.
Beautiful, thank you. So the poll question that I came up with during this presentation is, what sources do you use to keep up to date on policy changes in your community? And so I'm looking forward to seeing the results.
So right now, out of the choices, which are individual nonprofits, groups of nonprofits, foundations, and all of the above, the overwhelming majority are answering all of the above, and second place at about 11% is groups of nonprofits.
Groups of nonprofits. And, and that I echo that strongly, because that's who we as an organization rely on as well. So thank you for taking the time to take the poll. So as we move forward, I wanted to share with all of you how we can all work together to strengthen the community health worker model. And there was 5 things that I truly thought of, and I did discuss this with the team here at the organization. And so the first item that we truly looked at is a community assessment, the hiring of CHWs who reflect the communities we serve. How do we best train the community health worker? The service delivery, which is the landscape, and then lastly, the collaboration. So next slide, Jody. Okay, so I tried to pose this for you as questions. So after the presentation, you can go back to your offices, go back to your day-to-day, and truly analyze how is it that we as organizations are bringing together this community health worker and the pivotal role that the community health worker plays in our communities? And so one of the things I wanted to tell you is, our work, as you may all know, is driven by the strengths of the communities that we serve. And so we need to assess the community that we serve to best assist them in their immediate need. Now, as it relates to bullet number 2, as you may know, and with the pandemic, a lot of things have been magnified. One of them, as you all are aware, we are more and more diverse here in California and as a nation. And so I can share with you some trends here in Orange County that, will encourage participants to consider our own communities. And so from Orange County, and I want to get this right. So there was from the OC Equity Profile that was conducted and released last year here in the county, people of color accounted for the majority around 2004, now comprising of 58% of the population. And many of these individuals are immigrants. Now, one last informational item that I'd like to share with you is that we have a wide racial generation gap, indicating that the future will be even more multicultural. And that bullet point number 2 is critical as we manage and maneuver during this virtual world on how to best engage with these multiracial communities. Now, on bullet point number 3, it reads, are there other indicators that demonstrate need for targeted outreach? And I have to tell you, yes, there is. So if you analyze the clients that you serve, is diversity goes beyond what we see. And so with race and ethnicity, and that's true for our community and clientele, because beyond any demographic data that we may be able to obtain, there are those populations who will come from a different type of system, like the probation system, behavioral health system. And we can talk more about the service delivery and partnerships as we move on in the presentation. So one of the last things I think is very important, and I do bring it up here, is, does your staff come from or mirror this in your community? How are you identifying the individuals, the community health workers, promotoras, enrollers, to help handhold and teach self-advocacy to the communities that we serve? Next slide, Jody. So I go back to the hiring and training. What we have done as an organization is we use the OC Health Improvement Partnership database to identify specific geographic areas of need. And so because we service all of Orange County, what we have done is we hire from individuals within our communities where we can help train with the most up-to-date cultural competencies to make sure we are sensitive to the needs of the communities that we serve. So one of the things I do want to mention, and I can't stress enough, is we don't hire to meet a quota or matching percentages of the community. What we do is we look at the data of the communities that we serve, and then we try and match who we serve, and then we hire from that certain community. So beyond the hiring now is the continued nurturing and awareness and commitment to the diversity through ongoing training. So a lot of times, because we are a small nonprofit, we have limited resources as it relates to cultural competency training. So we rely on bigger entities. For us here in Orange County, it's the CalOptima does a phenomenal cultural competency training, or we also go to Access California Services, or we go to Cambodian Family, who can help us illustrate, and we can be culturally competent in serving the different communities. So that's there. So next slide, please. So the service delivery is also critical as we continue. Not only, this is pre-COVID, post-COVID. It's simply interesting to me and fascinating how the community health worker historically has always been important in the community, but for some reason we get a lot of attention and then it kind of tapers off, and then something negative happens, and then here we are again, or there's a new opportunity, and it's like, hey, what happened to all the community health workers that a certain employer used to house or a certain employer used to have? And here we are reviving them again. And during this pandemic, that is what we experienced. Is like, wait a minute, the community health worker continues to be pivotal during these times. And so as a service delivery is maintaining, and I can't stress this enough, and again, it's the ebbs and flows of the world that we're living in, but also what happened with immigration, what happened with the ACA expansion during 2013-14 with the Affordable Care Act. And so what's happened is a consistent presence in the community is important, because then we don't lose that trust and visibility with whom we serve. Now, I do want to share with you, and this is again going back to the intersectionality of the work that we do. What's interesting is that for some reason now, it's becoming more apparent of the intersectionality between, as I mentioned earlier, health and immigration, health and housing, what now they are calling the social determinants of health. And what we're talking about now as an organization is health equity. And so to achieve health equity, we need our clients to have health insurance, to have somewhere safe to live, to have their doctor that they can go to have their immigration status not being, one day, yes, I have a residency status, tomorrow I don't, always living in fear. And so the community health worker plays that self-advocacy role for our clients, so they won't lose faith in the system or the trust. But most importantly, now we're looking at a more holistic approach to the community health worker, promotora, and health enroller. One of the things I do also want to mention is telehealth. As because of the pandemic, in the beginning, I couldn't go to my doctor. So I had to wait about 2 months before I went to go visit. Thankfully, there was nothing wrong with me, but it was my regular blood work and so forth. But for our clients who had any type of emergency, the onset of telehealth. So as we are learning this whole Zoom world, and how do we share screen, and how do we make sure we engage the viewer in these presentations. Now imagine our community who doesn't have the resources that we do, who doesn't have that, they don't have internet. So now with the onset of telehealth, we again went to our partners and said, okay, how will you help us bring that tool to us as community health workers to help educate the clients we serve? And so telehealth, as you may all now be aware, and may even have experienced recently with your own physicians, is now you're not getting in your car and driving to the doctor's office. Now you're doing everything through your phone. And so what we have experienced with our clients is they still miss that one-on-one, the one-on-one interaction with their doctor. But in the interim, we had to pivot as quickly as possible, as many of you who are on this webinar and conference have had to pivot in Zoom. How do we do this in a quick manner where we don't lose the appointment with our doctor? Well, I don't know how to use FaceTime. I can text, but I may not know how to use, FaceTime. And so what we've implemented as an organization is telehealth education. Now, one of the things that did come up during one of our strategic planning sessions with our board is it's great that we are becoming technologically savvy, but one of the things that we cannot forget is to continue when the time comes, the one-on-one interaction, human interaction, patience and creativity and the listening to our clients that isn't over the phone. That we not only do we give option to go virtual with telehealth, but also to give the opportunity to populate their enrollment application face-to-face if the client needs that. So now we're giving 2 opportunities to our client to have their doctor's visit. 1, to have the conversation with you, whether it's at a community center, whether it's at a school, because now all the wellness centers are closed, at least, here in Orange County, we work a lot with Santa Ana Unified. And so all of that is that human interaction, we know that it makes a difference. So let us not forget that although, I feel technologically challenged all the time with Zoom and WebEx and all of these avenues to be able to connect, but the most important connection with each other is that one-on-one, face-to-face for even better service delivery. Next, Jody. So the next one is collaboration. I don't think any of us would truly exist if we didn't collaborate with each other, whether it's us individual nonprofits. And as I noticed with the poll, you did mention individual or groups of nonprofits, public agencies, that you collaborate with each other. And one of the partnerships that we have been able to successfully develop is with, we are one of the recipients in the county to have navigator funding to do enrollment into public assistance programs. And so because most of the clients that we serve as an organization are predominantly a monolingual Spanish-speaking Latino community, we said, well, there is also Cambodian people in this in Orange County, the Vietnamese community, the Muslim community, we have the refugee community. And so what we did also is we brought in partners to help expand our reach. And so, as you know, collaboration is critical all the time. And so now what we have done is, we collaborated with Access California Services, who focuses on Arab, and I don't want to miss this. That's why I wrote it down on my notes. They focus on Arab American, Muslim American communities. The Cambodian family has it in their name, focuses on refugees and immigrants from all over the world, more specifically from Cambodia. And so this formal collaboration helps us expand our reach beyond what CHWs can do. And so now we're serving 5, 6, 7, 8 different other populations that we alone as an organization could have never achieved. And so that's what makes the strengthening of our collaboration critical in our community. Now, as we talk about groups of nonprofits, for those of you who may be familiar, CHWs houses the Orange County Health and Enrollment Task Force. That is a compilation of about maybe 30 to 50 different nonprofits who come together, and we pull together agendas on a monthly basis to help share resources and up-to-date information on whether it's the California state budget, which was critical during May, June, and July with the May revise, June, which was when they voted for the budget, and July, because that's how we knew where we were going to land as a state, and then as we bring it down into our local community. And so we have about 60 attendees, and I have to tell you that now that we're in this virtual world via Zoom, that's how we're conducting our meetings. We're getting up to 70 individuals showing up to our presentations. So I think that exemplifies 2 things. 1, our need to connect. 2, the need of resources in the community with the most up-to-date information. And so as we look at also foundations, they've also been a little bit flexible in their giving. 1, and 2, they are beginning to shape their funding in a slightly different way where collaboration is key to funding. And so public agencies are also critical. We have, thankfully, a phenomenal relationship with the Orange County Social Services Agency. And so again, the communities that they can serve, we're able to serve. And that collaboration with Access California Services, Cambodian Family, and I also forgot to mention Project Kinship, they also help us serve a different population. And so it's truly a holistic type of outreach for us as an organization that feels empowering, but also we're able to give the tools and resources to the individuals who, you know, don't have it readily available. Next slide, Jody. And I think there was one more poll question, which, okay. So just a few last thoughts to share with all of you. I mean, I think we can all agree on the general value of the community health worker, but their role, again, is even more now important during this pandemic. And I find myself repeating that over and over again, not only in this avenue, but also in different venues that I have been a part of during this time. If you notice, there may be a few trusted resources of information for a family during this confusing and scary time. And so for you, the participants, what roles do you play within your agency? Can you continue to be that trusted resource to the clients you serve? Number two, think of how you can make the CHW's job easier and more effective, not only through intentional hiring and proper training, but also through the ongoing process of improvement and partnership. Partnership is important, which is constantly changing during this pandemic, because some organizations may be losing resources that you used to rely on. And so it is the ever-changing information that confuses all of us. But if we stick together, I think we can continue to we will continue to make through. And number three, especially during COVID, plans and procedures have had to become fluid, as many of you know. We had to pivot overnight. We had 22 sites countywide, and overnight we went virtual. Thankfully, our entire team had a computer, which is a laptop, and a cell phone, and we just simply redirected everything to online. So as the community's needs evolve, the needs of the CHW are going to change as well. And so I ask for your patience, truly focusing on how do we ensure health equity for our clients. And that's all I have.
Thank you so much, Georgina, for that informative presentation. And we do have, I think, at least one question. I'll just remind folks that if you have questions, use the Q&A function in the upper right of your screen. Put your questions into the Q&A box and we'll get to them. And I also, Georgina, we did launch the polls and I wanted to give you the results.
Nice.
The second poll, which was, do you feel that CHWs in your organization reflect the community you serve? It was almost exactly, in fact, it was exactly 50-50 yes and partially. There were no no's, fortunately. So that's nice to hear.
There's always room for improvement and working on things. I completely understand.
Yes, and then the second or the last poll, which was what sources do you use to keep up to date on policy changes in your community? Was a pretty diverse response. About 45% said social media, 2.7% said friends, 16.2% said other, 8.1% television, and 27% expert community partner. Yeah,
it reflects more or less what we have done as well.
And then one comment that I wanted to touch on is the biggest challenge we have is immigration lawyers telling our participants not to get WIC.
Yes, we have had those challenges, and for some reason they trust the lawyer more than they do us. And I mean, they're working on such complicated cases, but to my knowledge, we don't discourage our clients from enrolling into WIC.
So one question is, do you see progress with health plan reimbursement for CHWs since they are not recognized by Medi-Cal or commercial health plans as providers or practitioners, or the reimbursement is not sustainable?
Oh my goodness, that is a loaded, heavy question, which is a really good one because it's something that is, I mean, right now, in the near future, I don't see them reimbursing CHWs unless they're part of their team and employees. But in order, let's use CHIOC as an example, can we bill a health plan? Well, no, we can't, but we are actually enrolling them into a health plan. And so do I see that in the foreseeable future? Maybe. At this point, nothing is impossible. If we can try and advocate for that, I think that would be excellent. But I think the priority right now for the health plans and the providers who are contracted with those health plans is to get their reimbursement. So to add someone else as a community health worker, I think that makes it a little bit more difficult. Not impossible, but it does make it a bit more difficult. But right now with the provider reimbursements, they've been, going back and forth with Medi-Cal, it's not enough. And then, I mean, it's a convoluted process. But I think at this point at where we are in our lives and just the way the world is working, let's ask and let them tell us no.
A question, or I guess a comment. I was a CHW for 7 years. I feel my job could have been easier had all the CHWs across the county and different departments been able to meet up and share information and updates.
Yeah, and that's what we try and do with the Orange County Health and Enrollment Task Force, is to bring everybody together and most of us, whoever can join, be on the same page. But as I had mentioned in my presentation, what's happened with the community health worker is, and it started beyond the Healthy Families era. I mean, the birth of the Promotoras came about many, many years ago. And then it became a bit more sophisticated with the CAA, CECs, with Healthy Families, and then the Covered California era, and which they still exist, a certified enrollment counselor. But what happens is every county functions differently. We as a county here, we're small, we're complex, diverse, but we're smaller. So when you look at the county of Los Angeles, I mean, I used to work in the county of LA, and you're looking at the needs of the San Fernando Valley are very different to the needs of East LA, to the needs of Southeast LA. And so that is why even through the school district, they created these spas so that every community that had schools that were part of LAUSD, their needs were met. So as we go back to a model of the Orange County Health and Enrollment Task Force, just LA, San Fernando Valley would need their own, East LA would need their own, even Long Beach. I mean, Long Beach is densely populated, extremely diverse. And so their needs are going to be different than those of the other three communities that I mentioned. Then you get, the San Gabriel Valley, which is Pasadena, Monrovia, all of those mountain cities. You notice I'm pretty well versed with LA because I used to work there. Then you have Riverside County. You can't couple up the Inland Empire. I truly think it should be separated because the communities are different. The region is different. And so they're right. It would be beneficial if all of us can get on the same page as it relates to resources, since overnight housing or food or, any type of food voucher or housing voucher becomes obsolete the following day because the need is high.
And another question that may be broader than just you, but I'll run it by you.
Yeah.
How have you had success using the flyer CWA gave us with the legal help? What has been your experience? I personally have given that flyer out, but never heard if it is helpful or not. And I'm not sure if you know what flyer she's referring to, but since
no.
On our website, I can answer that it's actually not produced by us. It's from the Protecting Immigrant Families Coalition, and it's just sort of a list of regional, by region legal help that's either free or sliding scale or low cost for people to access immigration help. So I don't imagine that WIC is the only organization that makes that available.
Yeah, I'm not familiar with the flyer.
And I think that is all of the questions that we have for now. Just a reminder to folks, if you have any last minute questions, then enter them into the Q&A box. Oh, here comes another one. Because we don't have active trainings on this issue, I would not feel comfortable going against what a lawyer is telling one of our participants. It's great to encourage and reduce fear, but if we're not fully educated on the subject, should we be telling a participant to enroll and go against their lawyer's advice?
Well, what we have done, we have partnerships with, and they just recently changed their name. So if they're on, please forgive me. We have partnerships with Community Legal Aid and with the Community Legal Aid, and I believe it's still the Public Law Center. And we work with them almost every single day. As I mentioned, we have clients coming in who are eligible for health insurance coverage, but because they read something in the media, they come to us, well, do I cancel my health insurance coverage? And so, no, we can't guarantee them anything, but from our part, again, going back to the collaboration with our partners, we consult with them, and that's where the expert community partner comes into play. They do have an immigration department. They are experts in this topic, and they have informed us that at least for WIC, it's been okay. Unless they tell us no, we always make sure that we are safe on that end. We don't just say yes, don't apply, or we leave it up to them, but we don't encourage it either.
Yeah, I think that is the last question. So thank you everyone so much for attending this session, and thank you so much, Georgina, for sticking with us in the face of working out technical kinks. Everyone, don't miss our next session at 2:30. We're going to have Tiana Vargas from the San Diego LGBT Center, who will present on providing affirming care for LGBTQ+ community. And we'll also have some fun and fitness with Andy Padilla of HealthNet during our wellness break at 3:30. Now you can take some time to connect with our exhibitors through their virtual booths, and don't forget to check out our daily contests in the contest tab and on the event feed. Today's contest is to post a photo of your coworker or office. You can be creative. Dogs and kids are welcome these days as your favorite coworker or not favorite coworker, as the case may be. We will see you all. Let's not
go there.
Yeah, we will see you all a little later. Thank you so much, Georgina.
Thank you, everyone. Have a good rest of your week.